Good morning, Maranatha. I'm Velda Ford. We're having a COVID conversation, October 25th, 2020. There are many things that we need to know about what's going on, but let's start with 1 Corinthians 10:24. Let no one seek his own good, but the good of his neighbor. Whether or not you believe in the numbers, you believe in the disease, you think it's conspiracy theory, act like you're caring about your neighbor. Act like that there are people in the community who may be weaker and sicker and more likely to have a negative outcome. And think about them when you decide what your behavior will be. Let's look at these numbers. As of the 22nd, you can see that the trend line is going in the wrong way. The last time we had numbers this high, that is 75,000 cases in one day, was July 18th. And that was 2 weeks after the 4th of July, where it's easy to predict that 2 weeks after a lot of exposure, you're going to have a lot of cases. Importantly, in the United States, we've had 8.5 million cases so far and 224,000 people to die. Those are husbands, wives, children, grandparents who are no longer here. When you look at North Carolina numbers here, you'll see that we've had 250,000 cases, 4,146 deaths. And these are people we will not get back. What's important more than anything, more even than the cases, is the number of people hospitalized, because exposure happens, then you have a bit of a lag, then you have cases, people who are positive from 2 to 10 days later, then you have hospitalizations, which might be a week to 10 days later than that, and then you have deaths. All of it is sequential. So when you look at hospitalizations, then you know that people are sick enough to be hospitalized. And in Guilford County, we had 101 cases yesterday. What is new, recent studies suggest that you don't need 15 minutes of continued exposure with one person who is sick to make you sick. You can have 15 minutes total in a day. That is 10 people at 1.5 minutes or 5 people at 3 minutes, then you might end up with the coronavirus anyway. So what do you need to do? Consider that your best protection is prevention. I know you're tired. I'm tired too. I'd rather be on this beach that you see than sitting here in my kitchen pretending, but act as if your life and your health depend on it. And even if you don't care about everybody else, this is a good time to act like you do. The good thing is that the percentage of people who are actually dying from COVID-19 is less. There's still a lot of people dying, 1,000 to 1,200 per day. However, that is less as a percentage than was dying, and that is because we know more. And when we know better, we do better. We know what to do as far as when to put people on oxygen, when or if they need to go on ventilators, what medications may or may not work. But remember this, even if you have a mild case of coronavirus, we are seeing that there are a lot of people who are coming back with what's called long hauler syndrome. And that means that weeks and months later, they're still feeling sick. They're still having fatigue and heart illness, and they're having blood clots and strokes. They're fatigued. They don't have a good sense of smell or taste. They are just suffering and having difficulty breathing. Do you want to even potentially have that? My recommendations are to reduce your exposure and to reduce your sickness. If someone is inviting you to come to a party, a wedding, any kind of event, don't go. If you have to go, then spend as little time as possible in the environment along the fringes. Wear a mask. Try to make sure there's good airflow, like a window open. All therapeutics are not available. We've seen where the president and others have gone in, they've gone straight in the hospital. They've taken themselves to the hospital. They've checked in, and then they've been treated the best for 3 to 7 days. And we don't have that kind of control. Don't put yourself in that position. So we're still under restrictions because our numbers have gotten bad. So maintain physical distance. Your children probably will not be going to school, or they will be going differently than we had hoped. Avoid being inside, open the windows, wear a mask, stay 6 feet apart, wash your hands. This seems like I've heard this before. Well, if everyone did it, we wouldn't have to hear it anymore. If you feel sick, please check in with your doctor or your healthcare provider, because many people have died because they were afraid to go in, or they thought if they didn't have the coronavirus, they were supposed to stay home. If you have a heart attack or a stroke, or you're just feeling bad, you're having a lot of bleeding, you need to get to the hospital. If someone is in your house, you need to isolate them. That is, if you have to be the one to take care of them, be around them as little as possible, have as good an airflow as possible. If you need to give them food, put it on a tray outside the bed if they're well enough to get it. If they're not well enough to get up to get a tray of food, they probably need to be hospitalized. Then, if you have been working around someone who's sick, who is isolated, then you need to quarantine yourself. That doesn't mean that you can take care of them all day and then go to work, because you may be carrying even though you're not feeling sick. I know you're not going to want to hear this, but forget about Halloween and forget about Thanksgiving in its usual form. There could be no better opportunity for passing along coronavirus than having a bunch of people walking around together, playing, touching things like Halloween. And then Thanksgiving, all you need is one person in the house laughing, doing the things that you should do on Thanksgiving to pass it along to everyone else. Just consider that if you make a sacrifice this year, perhaps there are many more years that you and the people you love will have to celebrate the way you want to. Remember, 1 Corinthians 10:24 says, "Let no one seek his own good, but the good of his neighbor." Love your neighbor as you would love yourself. Keep God in your heart and keep 6 feet away from everyone else. This has been your Maranatha COVID conversation. Bye-bye.